Welcome back. Let's talk about your healthy living, because the signs of early pregnancy, oh my goodness, that can vary from person to person and from pregnancy to pregnancy. You feel like something just isn't right. Well, it's really important to ask, even in the early stages. So joining us now, Touro OBGYN, Dr. Vibha Rao is here to discuss the common pregnancy symptoms, how you got to pull through those first 12 weeks, Doc, when you feel like something may be off, but you can't take anything for it. So first of all, thanks for joining us.
Of course. Thank you for having me.
Absolutely. So where do you want to start with this?
Yeah, so just some of the most common symptoms of women experiencing pregnancy includes nausea, vomiting, or often what we call morning sickness.
Right.
It lasts usually through the first trimester, maybe a little bit through the second trimester, about 16 weeks, and it can happen from day to day. Fatigue. Right. You can't keep your eyes open. That is very, very common. Usually feel very tired, mostly from the hormonal changes and your body kind of getting used to the pregnancy. And that, again, lasts through that first trimester into that second. Frequent urination. Your body is processing a lot more through your kidneys, so it's filtering a lot more. You're going to pee a lot more. And also it puts a lot of pressure on your bladder, since your bladder sits on top of that uterus. And finally, breast tenderness. So the hormonal changes are going to cause your breasts to be tender, so they can be very sore and uncomfortable for pretty much the entirety of pregnancy.
So as soon as someone becomes pregnant, here comes the club. Make sure you do this. Don't do that. This is what happened to me. This is what worked. Where do you recommend new mamas go for safe information?
Oh, absolutely. I would recommend, if you don't already have a relationship with an OBGYN, to formulate a relationship, one that's still delivering babies, and have a safe space where you can ask questions. But then also, you know, if you have friends and family that are going through it, develop a good network where, you know, mamas that do it together really have better pregnancy outcomes, and that's been proven.
Is there anything that you would say this is safe to take in the first 12 weeks? For all of a sudden you're congested, you don't know why. You feel like you're catching a cold, but maybe it's just inflammation from all the hormones. Talk about just early pregnancy remedies.
Yeah, so we talk about, you know, for the nausea and fatigue that you're feeling, ginger tea, frequent meals, vitamin B6, vitamin B9 are pretty much my go-tos for all of that. If you're feeling cold, sickness, we say Tylenol is fine if you have a low-grade fever. Obviously, if it gets worse than that, we want you to seek medical care. But Tylenol, most over-the-counter sinus medicines are fine. Just always touch base with your doctor if you're going to start anything new.
Explain to people, as we close this, why it's so important to respect that 12-week mark. What happens with the placenta and the baby around the 12-week mark?
Yeah, so actually that first 11 weeks is when we talk about organogenesis, or all the little organs of the baby are forming. At the 12-week mark is also when your placenta takes over. So everything, all your day-to-day activities can have, you know, small effects on that. So, you know, staying away from alcohol once you figure out that you're pregnant, staying away from, you know, medications and things that you were taking before, or making sure that it's safe for pregnancy is really important. So establishing that relationship, establishing that care, downloading apps on your phone that give you accurate information are all important.
Dr. Vibha Rao, always just great reminders, because even, you know, you're on to whatever kid you forget, there's a first timer everywhere.
Absolutely.
So, thanks, Doc.
Absolutely.
All right, let's get over to Zach Fradella, who's learned all about this very recently, huh, my friend?
Yep, we're already in the third trimester, and the days are being counted down here to that due date.